When you look at, a lot of colleges or schools have been reopened, not all of them, but some of them for a couple of weeks. How difficult now is it to understand how the virus gets transmitted in these colleges?
I think the colleges are showing us that behavior matters. And so what colleges are seeing across the country is that teenagers and young adults will continue their normal behavior to varying degrees. And we can't expect people to completely change their behavior and create policies around it. So we're seeing outbreaks in colleges, we're seeing clusters in college towns, and a lot of that is because of this new mixing of groups that weren't together before the college, before colleges came back, but also because college students will be college students and they're going to go to each other's dorms, they're going to socialize, they're going to lack that social distancing sometimes, and we're seeing those behaviors play out in the form of clusters and outbreaks.
Lauren, one of the questions is if there is an outbreak or a student that tests positive, do you send everyone home, or do you actually keep them there to keep the cluster from spreading? I mean, do we have any idea 100% of what's better?
Yeah, I mean, it's a great question. I think colleges are struggling with it right now. You don't want to send sick or potentially sick people to a new location, right? So most colleges or many colleges have plans in place for how they're going to quarantine and isolate students who either are sick or have been exposed. And so putting those plans in place to keep the students in place, make sure they have the food, the water, all the daily living things that they need, and possibly the medical attention if they are that ill. So not having them and all the other students travel home with these possible underlying or asymptomatic infections or pre-symptomatic infections, so that you don't start a new outbreak in a new town.
Lauren, where are we on the vaccine? So there's a number of media talking about possible side effects. Do we need to talk or hear from the regulators directly?
I think what's happening right now with the vaccines is we're hearing a lot about the side effects. It's a lot in the news cycle. It's a lot of press around single or small events, and we're getting varying degrees of information from the companies themselves. It's always great to hear from the regulators, especially when you meet those benchmarks of the studies, to see what their interpretation is or to see what their next steps are. I think the AstraZeneca is a good example where we may not normally hear in a traditional vaccine development process of a pause for a safety analysis, but in this case, because it's so important to the global community, we're hearing about these things. Pfizer is expanding their vaccine phase 3 trial right now, and we're hearing a lot more about those minor side effects, the normal side effects that we expect to see in a vaccine trial. So while we do want to hear from regulators, we also want to see the data. We want to see those published reports. We want to see the outcomes of those individual studies.
Lauren, do we have enough manufacturing capacity once we have the vaccine to distribute it globally?
I think we have the potential for the manufacturing capacity, but a lot of work has to be done to ensure that the supply chain is consistent and not broken at any point during the process of creation of vaccines. There are so many elements that go into creating a global vaccine distribution company, and ramping it up in such a small amount of time is, a relatively new task for us. I think making sure that we have vaccine components ready to go, particularly if it's ready early and we have to compete with flu vaccine creation. All of these elements are going to impact the global supply and the global access of vaccine. So not just the creation of the vaccine materials themselves, but the storage of the vials, the cold chain supply, getting things safely in those cold temperatures to where they need to go. All these elements have to work seamlessly in order to do a global distribution.
In his new book, Bob Woodward basically says that President Trump deliberately downplayed the virus. Did we actually know much more about the virus than we were told?
I think that it's hard to say what we knew and didn't know then, or what he knew and didn't know then. But I think what's important to note is that there were underlying concerns that were expressed to him and that he is mentioning, and that did not then turn into policy changes or actionable items immediately to alleviate some of the impact of the virus on the U.S. So things that could have changed in our policy approaches or in our operational approaches through the use of our federal agencies, nationwide strategies that really could have impacted the virus spread and the control we had early did not happen.